Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report. The total number of cases remains at 292. 268 individuals are listed as recovered, and there are 17 active cases. Yesterday, 343 lab tests were performed, giving a total of 38,962. So our numbers in Manitoba continue to look favorable, and as we gradually reopen and continue to reopen in Manitoba, it's certainly not a return to normal, it's a return to our new normal. So we still need to be aware of this virus. We still need to be aware of physical distancing whenever possible. Our draft plan is online for a phase 2 opening, and I'd encourage all Manitobans to review it and provide feedback at engagemb.ca. We're going to all continue to take steps to stay safe from this virus, and that's in this new normal, it's vital that people stay home when ill. Even people with mild symptoms, we cannot be showing up to work or to school or out in public when we're ill. So I'd encourage all Manitobans to stay home when they're ill. Certainly stay in touch with healthcare providers, contact healthcare providers when you need healthcare advice. It's safe to see your healthcare providers, and so I'd encourage Manitobans to continue to do so. But if you are ill, stay home. You can attend and self-refer for testing. All Manitobans are eligible to be tested for COVID-19. So anyone with a runny nose, cough, sore throat, fever, I encourage you to attend for testing. For those individuals that are at higher risk of severe outcomes with COVID-19, those over age 65, those with underlying medical conditions such as cardiac or respiratory conditions, and those with immune compromise, our messaging is more cautious to protect those that are most at risk for severe outcomes. We'd encourage you to limit your contact with others, certainly washing your hands frequently, but you need to take extra caution to prevent yourself from this virus. Businesses that have questions about the orders can contact us through engagemb.ca. And we encourage Manitobans to continue to access our website, manitoba.ca/COVID-19, for up-to-date information. And again, want to thank Manitobans for all their efforts in flattening the curve here, allowing us to be gradually reopening things, and we're going to continue doing that with phase 2 in the near future. And just thanks again to all Manitobans, and I'll pass this over to Lynette now.
Thank you. Good afternoon, everyone. My name's Lynette Siragusa. I'm the Chief Nursing Officer from Shared Health. And I would like to begin today by thanking High Life Foods, who earlier this week announced $750,000 in support of 6 health centers, including 4 here in Manitoba. And those include Bethesda Regional Health Center and Bethesda Foundation in Selkirk, the Neepawa Health Center, the St. Anne Hospital Foundation, and the Killarney Foundation, which will be helping the Tri-Lake Health Center. This is a significant donation that will support various improvements to patient care at these facilities. So very much want to thank High Life Food for their continued support of the communities that they do businesses in, and let you know that that is very much appreciated. Some statistics to update you on: the number of healthcare workers who have tested positive for the COVID virus for non-travel related reasons remains at 26. 25 have recovered from the virus and have been cleared to return back to work. In the past week, 336 healthcare workers and first responders have been tested for the virus. An internal data validation exercise was performed in the past week and revealed that there were 3 additional travel-related cases involving healthcare workers. So that changes our previous numbers from travel-related cases from 8 now up to 11. These cases did occur early on in the pandemic and have all since recovered. Also, we launched our online portal and toll-free line 3 weeks ago for Manitobans to confirm their negative test results. More than 1,600 people have now confirmed their negative test results through the online portal in the past week, and approximately 900 people got their results by calling the contact center. As a reminder, public health will always call the positive test results, the positive cases, as soon as possible to provide instructions and guidance as to the next steps. Approximately 5,200 people have called HealthLinks in the past week. And just want to remind Manitobans that you no longer have to call HealthLinks or see a physician to receive a referral for testing. You can self-refer now. If you're showing symptoms, if you use the online screening tool that's available at manitoba.ca/COVID-19. This screening tool has received approximately 595,000 web views since its launch, including nearly 30,000 in the past week. So if the screening tool indicates that you meet the criteria for testing, I do want to encourage everyone to go for testing. We have lots of lab capacity. We're not at that capacity. And if you have symptoms and the tool says so, you should go and be tested. Lab tests. Last week we spoke about the efforts to ramp up clinical and diagnostic activity across the province, and that included scheduling patients according to the priority of care that they require. And this also includes lab testing. Patients who require a lab test that has been ordered by their family doctor or their specialist are encouraged to visit a lab in the community where possible to have their specimen collected rather than go to a hospital or a health center. As routine physician visits and activities start to increase, assisting us in this way will actually help the health system to better balance the flow of patients between the community and in our facilities. New announcement about St. Amant. We have been keeping a running tally, as you know, on the number of Manitobans whose health has been compromised by COVID-19. But the effect of this pandemic has had an impact on the mental health on a wider scale. And so in the past 2+ months, we have expanded mental health programming for those who are suffering from stress and anxiety. And this includes the Ability CBT, which is available to Manitobans ages 16 and up who are experiencing mild to moderate anxiety. This is both in English and in French. And today I would like to alert Manitobans to a new community wellness line that has been developed by the St. Amant Centre in response to the pandemic. At the best of times, we know that people with disability must manage stress and anxiety. A pandemic adds to that stress as they deal with changes or disruption to the services that they require. So this new community wellness line will support Manitobans living with a developmental disability, as well as their family and support networks. This line is open Monday through Thursday, 9 a.m. to 9 p.m., and is staffed by operators who have been trained to listen and share resources and provide advice to callers on how to cope and problem solve. So the number to call in Winnipeg is 204-258-7076. And for those who are calling from outside of the city, the toll-free number is 1-877-858-7076. And we encourage anyone who is struggling during these uncertain times to get the help that they need. And I would like to thank everyone from St. Amant for their tireless efforts in preparing this service for Manitobans. And last but not least, I want to acknowledge that today, or this week actually, is Paramedic Services Week. And the paramedics play a critical role in our health system, acting as often the first point of contact for patients who are having a medical emergency. These individuals face unpredictable situations in uncontrolled environments every day, yet their focus remains squarely on giving their best possible care to patients. So that focus has remained in place for the past 2+ months, even as the pandemic has added a bit more complication to their work. And as we mark Paramedic Services Week, we just want to thank the paramedics for their dedication that they show to improve patient outcomes, and always for their fantastic professionalism. So thank you very much to all the paramedics out there. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary question and one follow-up question. Up first this afternoon from Global, Brittany.
Good afternoon, Dr. Roussin. Question for you on masks and gloves, specifically at restaurants. We've spoken to one restaurant owner who says the health department has come by twice over the last 2 weeks and said the servers and staff don't need to wear masks. People just need to wash their hands more often, but we've heard that it's recommended that the public wear a mask if they can't physically distance. So there seems to be a bit of mixed messaging. I'm just wondering if you can give us an example as to why maybe health inspectors would be telling restaurant owners their staff don't need to be wearing PPE, or should they actually be wearing masks?
Yeah, and so first on gloves, I think it'd be it's much more important to frequently wash your hands than wear gloves in those circumstances. As far as masks go, non-medical masks, these are again options, and so the ensuring no is showing up ill. Frequent hand washing, maintaining physical distance whenever possible are much more important. In addition to that, people may choose to wear non-medical masks. If you wear them, you need to know it's not protecting yourself. It may protect people around you, and they need to be used properly, or they, there could be certain issues if you're touching your face and not taking them off properly. So we've always had it as an option. We don't have mandatory mask use here, and so that's where our messaging is right now.
Thank you. And I'm wondering, with another day of no new cases, how quickly we might start seeing the restriction for phase 2 coming in, or easing to come in ahead of that June 1st original target date.
Yeah, and so I think later in the week there'll be an announcement on the specific date, so I don't have those details right now. But because of our numbers, because of the work Manitobans have done, we've been able to increase the group sizes ahead of that date. And then later this week, we'll announce the specific date for phase 2.
From the Brandon Sun, Bud.
Hello, Bud Robertson at the Brandon Sun. This one's for Dr. Roussin. I was wondering if you could help me clarify something here. The Canada Border Services Agency, they issued a notice on reminding Manitobans that if you visit the International Peace Garden, you're actually leaving Canada, you need to quarantine and to get back. But there's a line here that confuses me, and hoping that the medical professional could help. It says the officers will instruct travelers to quarantine if they're asymptomatic, or isolate if they're symptomatic for 14 days. Now, that sounds like the same animal to me. Can you clarify it for me at all?
Yeah, that's just more of a technical definition. So when we talk about quarantine, that's by definition it's people without symptoms, without the illness. And then when we talk about isolating, we typically will use that term when people have the illness and they're self-isolating. So it's just more of a technical difference in the definition.
Okay, thank you. And this one is for Lynette regarding the announcement on St. Lynette. There are a number of mental health lines out there. What sets St. Amant apart for this?
Well, they are specifically, this line is for Manitobans and their families with disabilities. So maybe some special needs that they can address that wouldn't be for the general population, but I assume there would be many of the same themes and principles, but just specific for that population.
From CJOB, Diana.
Good afternoon, Diane from 680 CJOB. Dr. Roussin, how have the first few days of asymptomatic testing gone? Obviously, we haven't had any cases over the past couple of days, but what are the first couple of days showing you?
Yeah, and I think that I don't have the specific numbers. Certainly, you're right. We're not seeing cases, which we would expect. We know that we have a very low test positivity rate in Manitoba, and we'd expect that with the addition of asymptomatic testing, that it would be even lower because these are lower risk individuals. And of course, the asymptomatic testing is entirely voluntary. People will be offered it, so some will accept, and others may not be interested in that. So it's really early on. Don't really have many details to share at this point.
Okay, and then just as a follow-up, I know a week or two back you mentioned now is not really the time for garage sales, obviously giving physical distancing requirements. We have seen a few signs up around the city for yard sales. Is the messaging still the same in terms of don't go to one, don't hold one, you shouldn't be anywhere near a yard sale this time of year?
Yeah, I mean, I think that Manitobans have really flattened this curve. I think that we're starting to gradually reopen things. Certainly not a return to normal, and so certainly the group sizes need to be respected. Physical distancing needs to be respected, and then when you're talking about garage sales, then you're going to have these frequently touched surfaces or objects that add a little bit to the risk. So I'd be cautious with it. Certainly the orders don't prohibit it given the group sizes and it's outdoors. But I would still a bit of caution to make sure you're washing hands frequently and that there isn't crowding taking place.
From the Winnipeg Sun, Scott.
Hi, Scott Billick here, Winnipeg Sun. Question for Dr. Roussin. It looks like Ontario is having a bit of a resurgence in cases, or quite a few cases being reported on a daily basis. How does that affect some of the, I guess, the border, like the border, not the border closures per se, but like just the rules for traveling across border, and is that part of the epidemiology that you're watching for when it comes to when or not that self isolation period would end?
That's right. And so Manitobans, we've been able to flatten the curve here. There are cases in other jurisdictions, and so we need to be aware that we are at risk for importing virus here, and so that's why we have those self-isolation orders in place still. And so with all these orders, we look at them frequently. We're going to decide on how long we'll need that in place for. But as of right now, that's the exact reason why we have them. We want to ensure that we don't have the virus being imported into our province.
And follow up, is there a delay at times for a long period of time when it comes to positive tests that you guys report? And just going anecdotally on some different things I've seen on social media and stuff, where people say they have family members that tested positive, but they haven't been counted recently, and in the reports that are done. Is there a reason? Is that happening, or do tests take some time to, I guess, maybe get confirmed before they're reported? Do some take longer than others?
Well, we would have, at the lab, usually about that 24 to 48 hour turnaround once the sample's at the lab, and then it gets reported out to public health, and then the case is contacted and a contact investigation goes on. And then usually the day after we report out that lab, then it enters into our our numbers that we report out publicly. We give that 1 day just to review, ensure it's not a false positive, ensure it's not a positive result on somebody who was previously tested positive, and then we report them out the morning next.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. It's Mohammed from Radio Canada. I have a question about social distancing. When you go in areas like Croydon or the Exchange District, you see a lot of people and patients, clients, and employers not respecting social distancing, and employers are not wearing masks and are welcoming clients with less than a 2 meter distance. What are your thoughts about this, and how can we make this safer?
Yeah, and I think that the messaging is that we need to start reopening things. We're gradually doing it, and I think it's the right time. I think it's a safe time to do this, but it's certainly not that return to normal. And so we still need to be respecting that physical distancing whenever possible. Non-medical masks are certainly an option for people, again, with the knowing the limitations and how to use them properly is really important. And so I think that most Manitobans have been following our advice. I think most Manitobans will continue to follow our advice. And then there'll be certain times, I'm not aware of the specifics of what you comment on there, but there might be times where you need to remind Manitobans of the importance of this. And then certainly there's the ability to enforce the orders, but we rarely need to do so. Most Manitobans are really aware of this, and the actions moving forward are what's going to allow us to further reopen over time, right? So as we move into phase 2, we're going to follow numbers closely. If they continue to look favorable, then we'll be getting into phase 3. But it's all going to depend on Manitobans still being aware of this virus.
Thank you. And I have a completely different question as a follow-up. Can COVID-19 spread through HVAC systems? There's some engineers who are working with the university to better understand how viruses can travel through air currents. And in some parts of Quebec, fans could be prohibited in schools. And what is your advice on this here in Manitoba?
Yeah, so this virus is predominantly spread through large droplets. And those droplets don't stay suspended in the air. They fall quite quickly to the ground. And so this is the whole concept of that 2 meter distancing. So we don't consider this what we'd call an airborne spread, where we would see that if there was a ventilation system, we could see it, an airborne virus being picked up and moved quite rapidly around a building. But with a virus that's spread through droplets, that's not a major issue.
From CBC Manitoba, Aiden.
Hi, good afternoon. My question is for Dr. Roussin about the 2 new cases in Winnipeg that were announced on Friday. Are those cases linked to the case in the Walmart employee?
They are contacts of a case, yes, the most recent case. So we wouldn't consider those community-based transmission. They're linked to a known case.
And regarding asymptomatic surveillance, do you have any plans to target specific groups of people or regions with the asymptomatic testing? And what are the limitations of asymptomatic testing?
Yeah, so the limitations of asymptomatic testing is that the value of a negative test in a person without symptoms is relatively low. So if you don't have symptoms and you have a negative result, we can't put much weight on that. If that person, say, develops symptoms a few days later, they can't rely that they had a negative COVID-19 test. They still need to be tested at that time. So that's the major limitation of the of testing asymptomatic people. We're looking at targeted asymptomatic testing. We certainly will probably not be at any point where we just do large, widespread, indiscriminate asymptomatic testing. There's really low value in that. But we might look at groups that say are required to leave the province frequently due to their occupation. We might offer regular asymptomatic testing to them. And then sort of the surveillance or sentinel surveillance where we have, say, at healthcare facilities that just anyone presenting for whatever reason, we would offer them a test, and that's just to ensure we're getting a community sampling of to ensure we're not missing any of the virus.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, can you comment at all on what inputs the province has received so far on the draft plan for phase 2?
I think that I don't have all the details on that. We're reviewing that, and we're going to hold a town hall session to get some further input on that. I think that a lot of the results from that we've heard of phase 1 are largely positive, and I think from phase 2, again, most of it being positive. And so we're going to start compiling some of that feedback and take a look and see. But we're really hoping that this week we could announce a firm date for when phase 2 is going to start.
And do you foresee the final phase 2 reopening plan to be very different from the draft? Are you getting a sense right now that there are changes needed to the plan?
I don't think that we'll see a plan that's substantially different than what's in phase 2 now. Certainly, we're getting some feedback, and as we revisit the plan, there'll probably be certain changes to it. But I don't think there'll be any substantial differences in that plan.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwin from CTV Winnipeg. I was hoping to maybe get some more information about the 2 tickets that were handed out to the home care service in Brandon. It says they were failing to take immediate and adequate precautions to control and minimize risk of transmission. What exactly was happening there that didn't meet the standards?
Yeah, so we're not discussing the details of that. So we were made aware of the situation. The medical officer health issued orders, and then these enforcement was necessary. But we're continuing to work with that group to ensure that compliance is going to be in place going forward.
Okay, and then another question about interprovincial travel and self-isolating afterwards. We saw you tweet about that over the weekend. Is this an issue or a problem that you're noticing, or is it something that people have been brought up to you?
No, I think it's just based on our epidemiology that Manitoba, due to our geography and due to timing, we've been able to flatten our curve. And we still see virus circulating in the communities and in other provinces, and so we need to ensure we're limiting the risk to Manitobans of importing this virus. And so that's just the typical reminder that we put out that we don't really want to encourage non-essential travel outside the province because right now our numbers have looked favorable, so we want to keep it that way.
From City News, Stephanie.
Hi there, Stephanie Westduke from City News. Mr. Agassi, you spoke about a donation that Highlight had made earlier in the press conference. I'm just wondering if you're aware of complaints from employees within the plant who say that the working conditions, the cleanliness of those plants are below par. Already teamed with some other concerns we've seen about cleanliness in other food processing plants across the country.
No, I wasn't aware. That hasn't been escalated to me.
Okay. And just a quick question for Dr. Roussin. With Manitoba's low numbers the past several weeks, have other jurisdictions reached out to you in particular just to see what we've been doing that might have been different?
Well, we meet regularly with all the other the Council of Chief Medical Officers of Health and our Special Advisor Committee. So we meet 3 times weekly right now. So we're always in discussion, and I think that everyone is doing much of the same interventions, and with Manitoba, our geography and then the timing of this is what's set us in this position. And so we've worked together with all the provincial and national partners, but Manitoba has been largely in a good place because of timing. We're able to get ahead of things.
From the Winnipeg Free Press, Carol.
Good afternoon, it's Carol at the Free Press. I was just looking back at the notes, and the Premier said back in late April that for Manitoba's economy to successfully reopen and for consumers to start feeling confident, testing numbers needed to increase. And the Premier said that number would triple to 3,000 tests a day by the end of the summer. Is there any minimum number of tests required for Manitoba to safely, confidently reopen?
Yeah, I don't think I'd have a firm minimum number. Certainly having the capacity to test is what's really important, and we certainly have that capacity to increase our testing. So I think what's important is that we have the ability to test all symptomatic Manitobans right now. So any symptomatic Manitoban can present for testing, and that's the important thing, not necessarily the actual numbers that we're getting done. And in addition to that, because we have this capacity, we're able to do some things like the asymptomatic testing. And again, what we can do is that asymptomatic testing can be rolled back very easily should we start getting increased demand with symptomatic people, because that's the higher risk. And so I wouldn't focus necessarily on the number of tests. I'd focus on the ability to test, and then who's eligible for testing.
Seeing as you have the capacity right now, and you did talk about targeting asymptomatic testing, why not target asymptomatic testing for retail or restaurant or caregivers in group homes and do a targeted test that way, just to sort of, if nothing else, restore confidence in people who patronize them or use their services?
Yeah, and so we can always look at type of things like this, but remember the limitations of a negative test result in a person without symptoms. So that's a negative test right this second. Tomorrow, if that person is symptomatic, that could be COVID. And so to reassure people in those circumstances, that's not really the ability of this test to do that. And so we want to ensure symptomatic people are staying home. We want to ensure we test symptomatic people so we can identify cases early and do contact tracing. And then we'll do some of this targeted asymptomatic testing because we have capacity, and just to get an idea of what may be circulating in the community.
Thank you. We have a few minutes left in today's media briefing. If media have any further questions, please proceed.
Dr. Roussin, it's Carol at the Free Press. I just want to know, are hookah pipes or shisha included in the public health orders? I'm just wondering if outdoor patio is offering a hookah pipe to customers. Is that okay?
That's like sharing something like that would certainly be, public health would be advising against that. We'd have to look at sort of a specific situation to do that. We don't have that mentioned specifically in the order, but that would not be sharing of such things like that right now during the pandemic would not be public health advice.
So if you weren't sharing it and just using it one person at a time, that would be okay?
I'd have to look at the situation. We'd have to see that to be able to provide a recommendation.
Dr. Roussin, it's Brittany from Global. I'm just wondering if you have any concerns about the testing numbers that we're getting so far. Once we did open it up to all symptomatic patients without a referral needed, we did see quite an increase, about 700, 800, 900 tests performed in a day. And then we started to see some go down to 240, 300 tests. Do you have any concerns that we're not testing enough people to be able to really get an idea of how far spread this virus is in our province?
Yeah, that's not a large concern for me. I think that we're going to see naturally lower testing numbers over the weekend. So late last week, as we increased things, we did see a trend upward. So we'll see what we get this week. And so again, for as far as testing goes, what I'm concerned about is having the ability to ramp up our testing, and we do have that capacity. And what I'm concerned about is that we're able to test all symptomatic Manitobans, so we don't have restrictions on who can be tested if you're symptomatic, and then we have a low test positivity rate. And so those are the things that I'm really watching. But I do have a feeling we'll see those numbers increase over time as we get more into the asymptomatic testing, and people can self-refer to the testing sites.
What is our testing capacity per day?
Sorry, I missed that one.
Sorry, what is our testing capacity per day? How many tests are we able at the highest range to do in a day?
Yeah, so like certainly we, like 1,000 tests per day is something that we could sustain for a long time right now, and then certainly on days that we received up to 2,000 tests, we could do that as well.
Dr. Roussin, Diana from 680 CJRB here. Other than the present cases of COVID-19, obviously we've got 17 active cases. How do you kind of explain to Manitobans that the virus does still exist in the province? Like, what's the evidence that's still here for those who are kind of looking at this saying, look, we've got really great numbers, our risk seems to have dropped?
Yeah, and I mean, I think that our risk certainly is in a favorable position to start reopening the economy like we are, and to continue that. So I think that we just still have to be aware that this virus is likely still circulating. We'll see cases pop up here, and then we'll have contacts that will develop the condition as well. And so it's just important that we don't just rush to return to normal. That we still be aware of this virus, the physical distancing there, and I think that our stringent public health orders at first really got Manitobans on board. And so Manitobans are going to continue to be aware of this virus. They now realize that this is a safe time to start reopening things, that we can gradually do more and more, but it's not the return to normal. We still have to have that physical distancing. We still have to be washing our hands. And then again, in that new normal, we can't have people who are ill, people who are showing signs of respiratory illness at work or at school or out in public.
Dr. Roussin, do you think there's a fear in some people to actually get tested? You talked a little bit about stigma before, but also people who've seen what that test looks like to get. Is that maybe keeping some people away?
So certainly stigma, and we talked right from the beginning about the importance of credible information, and so certainly stigma can be an issue. That people don't want to be labeled with it, and sometimes then contacts are notified, and then there's that blame, right? And so no one intends to get ill with this virus, and so it's no one's fault if they test positive. And like I say, sometimes symptoms are very mild. And it's a new normal. So as people are still learning, and so when people get exposed, it's not about blame. It's about case identification early, and contact tracing. So we certainly want to destigmatize the testing, destigmatize this illness, because like I've mentioned, that's stigma is often an ally of these viruses. The more stigma we have, the more easily this virus can spread in our community. The nasopharyngeal swab is, mildly can have mild discomfort, but most people tolerate it very well. And so I would, encourage people that not to avoid testing for that reason. It's a test that's performed. It's how we test for the flu every year, how we test for a number of respiratory illnesses. So it's not a new method of testing. So I would really encourage Manitobans to get tested if you have any symptoms, even if they're mild. And you know what? Even if you're not that sure, go for testing. We have a lot of capacity, and this way we can find cases really early.
Aiden from CBC News. I'm wondering about probable positives that are found through the asymptomatic testing program. How will reporting work for probable positives through that program, and are there any concerns about false positives?
Yeah, the reporting will be the exact same. And so when we have anyone who tests positive, they'll be notified immediately by public health, and contact tracing will commence, even if they're asymptomatic. And so we'll have to interpret the results cautiously, but a positive result will be acted on as if it was any other positive result.
Hi, it's Michelle from CTV. I'm wondering about when would you look at lifting the self-isolation for interprovincial travel? And by when, I mean, like, what would you need to see in other provinces for caseload in order to open that up again or reduce that restriction?
Yeah, we'd have to see certainly the trend downward in new cases in other provinces. Certainly need to see that R number obviously below 1 in other provinces. And those are the type of things that we would look at, and it'd have to be sustained because it's with these orders we don't really want to go back and forth, and that's same with our reopen strategy. We want to keep the progress reopening. We don't want to have to draw it back should we go too quick, and so it'll just have to depend on the numbers we see in other jurisdictions.
Dr. Roussin, speaking with you from City News, can you just explain in layman's terms, again, the R value to people, what that number is?
Yeah, so this is what we would call the basic reproductive number, and it's essentially the average amount of people who would be infected by a single case. And so the higher that number, so conditions like measles, that R number is 16. So a single individual with measles introduced into a population that is completely susceptible, an average amount of 16 people would be infected. For COVID, that's probably around 2.5, that number. And so and then the number changes over time if you have more people getting immune, or if we limit the amount of contacts people have. And so that was the whole idea behind physical distancing. The less contacts a person can spread it to, then the less that R value is going to become.
And that concludes today's media briefing. Thank you.
Thank you.